Hey, what's up? I have something to show you from the last video when I said when I was driving out to Tampa and you have a whole bunch of caffeine and it starts to kick in. So this is what I call it, the War Machine, and that's of course that's some reference to wrestling, but this is what it is. Full paying customer. It's pretty close to what Redline was. I don't even know if they make Redline anymore. I think that company puts all its efforts into making Bang, which in our pantry, Allie has about 4 or 5 different flavors. Again, paying for it. Interesting stuff there. But that's the drink. Let me get a little drink here. All right, hey. Years ago, when I was at Nike consulting, when Spark was a thing, probably still is a thing. It's just not what it was back in several years ago. I was always very, very intrigued by the action sports athletes, and these are skateboarders and surfers and mountain climbers and all these types of things that we typically see in the X Games. Obviously, they Nike calls it something different just so they have ownership of the name. But those are the type of athletes that we're talking about, and particularly, it's easy to envision skateboarding. It's easy to envision what these guys and girls look like. And they're obviously, most of them, if not all, look like Justin Bieber at the age of 12. And it's really quite interesting how skinny and wimpy they look. However, the amount of forces that they are absorbing when they land, forget about the athletic ability, that's off the charts. The dexterity, the precision, the timing. But when they land, think about the gravity. Obviously, the board or whatever the implement is going to attenuate a little bit. But here's the thing. These guys probably couldn't lift a pound of deli meat, but the amount of forces that they can attenuate is absolutely staggering and incredibly impressive. You can even take that into some other sports where connective tissue strength is far more exceeding of contractile element strength. I think that's something that we'll probably talk about eventually here on the different choices that you can make in how to improve performance or different versions of strength. But one of the things that was very consistent with these action sports athletes, while they were not weight room guys or girls, they were incredibly adept at developing the type of forces that their context required. And the qualities that they did show that were incredibly exceeding as well was mobility of all joints. We're not just talking about the shoulders, the hips, and the ankles, which are going to be crucial for high levels or maximum levels of force production and minimal joint wear. That's the joint by joint theory, which is absolutely correct. It's just not going to give us the explanations that we're looking for all the time. When we looked at these action sports athletes, they also had significant mobility through the spine, significant mobility through knee rotation. A lot of them, I don't remember there being any Baton scale measurements, but these guys would have recurvatum of their elbows. They would be able to bring their thumb back to their forearm. Lots of mobility. No such thing as hypermobility. There's just understability. That's from my guy Alex Kraz in the UK. Because if you're strong enough in the different forms of strength, there's no such thing as hypermobility. It's not a thing. You're just weak. You can't change it. But you can control other things. And when you look at gymnasts who are incredibly strong, they're just as hypermobile as everybody else. I don't care if they only have 5 out of 7 of the Baton scale. All right, so you've got these folks that don't appear to be very strong. You've got these folks with significant mobility everywhere in the body, not just where our mobile segments tell us in the joint by joint. Okay, now let's fast forward a long time, and recently I watched a video of a online course of Leon Scheitau. Leon Scheitau is, among several things, osteopath, naturopath from the UK, and a tremendous messenger in terms of understanding fascia, in terms of understanding manual therapy that usually skews to a parasympathetic influence. So the soft manual therapies where you're not digging and you're not smashing spines. And what he was discussing brought up a slide from a fellow named Grakusevsky. And I remember being exposed to Grakusevsky's, and I hope I'm saying it correctly because I hear a lot of people say it differently. His book was called Spinal Engine, which is very, very famous. And I probably got exposed to this in '08 or '09. And Scheitau put the slide up, and it was a very, very common-looking slide describing the segmental model of spinal stabilization, where you basically have a bunch of squares that would represent the vertebrae, and then a bunch of X's that not necessarily would only represent the multifidus, but other muscles that only cross at the segments, versus the Euler model, which would have the paraspinals, that would go multiple levels. And these are two very, very valuable pieces to the puzzle, because it's not only creating a firm spine, a stiff spine in this very, very efficient degree of neutral, which is very, very important for force production with minimal joint wear. There's also a secondary level of stabilization, which is probably true of all joints, that tells us that if these joints have maximum mobility, that's going to have very, 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 very high levels of relaxation of all of the structures, both active and passive, that cross at the vertebrae. So we're not only talking about multifidus and other forms of soft tissue, we're going to talk about the capsule, which is just a more fibrous version and a non-contractile version of some of these muscles. When all of those things are at a very, very high level of relaxation, in theory, the spinal segments are very loose. Now we can kind of reference that back to the skateboarders and the action sports. Now here's the thing. What Spinal Engine was trying to tell us was that in this environment of incredible mobility, the body was in the best position to create what we have also learned of the greatest athletes in the world, that have the quickest timing to stabilize the joint. Here's the thing. I talked about this in T equals R, so we're going back to 2009. I called it, because I just learned, I was very excited to do two things. Number one, share something that I thought was very, very important that wasn't really being talked about, but also added a complement to the joint-by-joint theory, and it was called the core pendulum theory. And the core pendulum theory said that when a joint had maximal mobility in lots of different directions, then the spinal stabilizers, or the stabilizers of any joint, would be the quickest to have this reflexive contraction to stabilize the joint. The body would have this reflexive stabilization when it knew it had to. And the speed in which these joints could become centrated and have ideal agonist and antagonist of the stabilizing muscles was very much linked to having high levels of mobility. And that kind of gave us an understanding of, I kind of just went from here, I went from here, I went back to here again, and now I'm here with the action sports athletes. So that's the something that's very, very interesting, where that slide made me think of the core pendulum theory, which, it's not like it took on. I think it didn't take off, not because it mattered. Then we're not going to put core pendulum theory on the shirt, but you can see this shirt, one of the greatest minor league teams. We've got the Montgomery Biscuits, where Andrew Hauser was athletic trainer many, many years ago. So it didn't take off because it really wasn't training. It was more explaining why people would get better out of pain by mobilizing joints, because at the time, joint by joint was somewhat linear at that time. I don't think it was because it was meant to be linear. I think it was linear because people were not really understanding the full context of different training and rehab environments. And also McGill's Big Three were the creme de la creme of spinal stabilization. So it's like, how can you have to have this incredibly stiff neutral lumbar spine, but then doing mobilization drills, Maitland, McKenzie, etc., seem to help people with back pain. And I gave the example of the core pendulum theory to explain why people would change, and then several years later, appreciating the performance aspect as evidenced, or at least as by demonstrated by these action sports athletes. So there's a lot of links there that make very interesting. Let's go tell to another story. We need the TV bumper change. I don't remember what year it was, but I was working with a young lady who was an Olympic bobsledder. I've actually worked with 2 female Olympic bobsledders, which I think is kind of cool. So she had been treated by lots of folks, and one of them was Ado Zylstra, who is a fantastic therapist. He might still be in Michigan, I don't know, because his company name changes all the time. But it's where I first learned dry needling. And it was where Gray had recommended to learn dry needling. Fantastic courses. I just don't know what they're called anymore, so I'm not going to say. But the young lady had described she had seen Ado and had gotten treatment that she termed a full neural reset. And what it turns out that basically what this was treating the multifidus at every spinal segment all the way up and down the spine. I'm like, well, it's interesting. You're going to have to sit there a little bit. You're going to have, if you move around, nothing terrible happens, particularly if you're needling correctly. But that being said, I'm not sure that sounds terribly appealing, but that was something that I tried to understand and asked Ado a little bit, but I really tried to understand on my own. And I went back to the core pendulum theory, where now, even though bobsled doesn't appear to have significant rotation, the sprinting, the little hippity hop to get in and out of the train, clearly the spine is always going to be involved. But other thing too, which I happen to believe in, is that if we can have more relaxation at the spine, clearly we're going to have more variability for any level of spinal motion, flexion, extension, combinations, rotation, etc. So if you are an individual, let's say it's American football lineman on either side of the ball, significant twisting, significant changes in sagittal position, and then toppling a transverse plane rotation, striking, etc., hundreds and hundreds of times a game. The more relaxation that you have at the spinal segments, then more variability, more options to stay away from positions that may be perceived as threatening or noxious. I think this is a big piece to how people hurt their back or not hurt their back. It's not because something was inherently wrong. It was that whatever level of mobility that was or wasn't at these individual spinal segments, that's a very, very important role, in my opinion, so you can feel something before it happens. This is the split-second nature of proprioception, and then get out of that position. But if you don't have the mobility to begin with, you can't get out of that position and stabilize and centrate. And that's what Grakosevsky was talking about in Spinal Engine. Now, he's a nuclear physicist, nuclear something or other, and it might not be as simple as that to explain, but I thought the core pendulum theory was going to fill that bill. Now, so I bring up this video because that is for individuals that I will see multiple times in a week, particularly for high levels of performance. That neural reset, I just call it, we're going to needle the whole spine. And that's the reason that we're doing that, because if you can get into the multifidus, what is dry needling doing? It probably a whole lot of things, but one thing that I don't think is useful to disagree upon is that you are relaxing contractile tissue temporarily. So if we can relax that, and then we can move into these positions that give us an end range to stimulate some collagen development, we can now create multifidus that allow for significant amounts of rotation. I'm looking for the levels of rotation and level of mobility that you see in these incredibly hypermobile skateboarders, and trying to put that into other forms of humans that have significantly more mass, significantly more contractile element, strength, power, endurance. But we're looking to create almost like this Frankenstein, and you're taking, obviously some folks will likely know who and what I'm talking about. I'm looking to take some of the things that make skateboarders really, really good, and put that into what an American football player that puts his hand in the ground 75 times a game. So multiple individuals that do that, and I think that's a very, very interesting concept that also gives us an understanding of maybe why things like cat and camel work, why self-pumping works, which is basically just sitting cat and camel that you're doing on your own. Segmental rolling, which puts the lumbar spine apparently in close to its 12 degrees of rotation, particularly when we're doing the lower body driving of that pattern. Some of the other types of spinal motion. Remember, lumbar spine in different directions. What do we have? 55 flexion, 12 I haven't said it in a long time. I forget what the extension, and then 12 rotation. So to try to increase more, no, not the answer. Stabilize these norms, and if you have a little bit more, great. You're going to have more when you're either genetically predisposed or your activity helps you develop it in a sequential progressive fashion. Cranking on your lumbar spine to get more rotation is not what I'm saying. And clearly cranking is not always the answer. That might make you feel good at the moment, have a go. But ultimately we need to be progressive, and there needs to be a contractile piece to that to stimulate development of collagen in the surrounding connective tissues. So there's some links there. There's some links. I think the other thing that's a little bit more fuzzy, as I've been exposed probably over the last 5 to 7 years, more and more on osteopathics, clearly, if there is pathology, and I don't treat any of this as a physical therapist, but I need to know it exists so I can help people get to the other right people that can help them. Clearly, I have got a strong belief that if there is pathology of an organ, yes, that organ does receive its primary innervation at a spinal segment. The more variability that we have at that spinal segment, then the nerve will have more options on where it can live in this constantly fluid what do we call hydrophilic environment, where it wants to be near water, but it's constantly moving. Think of you put a string in water. It's never going to just stay right there. So if the more variability that we have, then we can track that back. Now, I'm not going to sit here and tell you that if you crack T7, you're going to solve liver cirrhosis. That's ridiculous. So but ultimately what we can look for, though, is this appreciation for all of these organs require a neural flow. They require electrical stimulus for them to do what they do. So where do those nerves go? They come through the nerve root. I want the nerve root to have as much variability as controlled by the muscles and connective tissue. I want the fascia around the liver to be very, very mobile. I remember Sam was treating me once. He goes, "Oh, your liver is tight." And I'm like, "What is this?" And he goes, "Well, you learn." And it's there was nothing wrong with my liver, but these are some things that would probably live outside of traditional physical therapy, but maybe chiropractors and osteopaths have a stronger element. The key, though, anytime there is pathology, I don't really care what the technique is. I do care that the tests are consistent. I don't think someone's allowed to put their hands over your chest and be like, "Oh, you have this, this, and this in your adrenals." I think that's really unfortunate. But I do think there's very good reason to apply treatments that improve mobility at the spine for some of these more peripheral issues, whether that is, if it is medical, I don't think that's in the realm of physical therapy, but I do think it's in the realm of chiropractic and osteopathy. Of course, allopaths wouldn't really, a traditional trained doctor wouldn't really be into these things, but there's also medicine that should be able to help some of these organs. So I think it puts into context spinal mobility. I think Rakushevsky was somebody that explained this, and I don't know when Spinal Engine was written. I want to say 2005. I was exposed to it a few years later, and it gives us this understanding of how quickly individuals can stabilize when they have mobility, and you want this reflexive nature where you just take a hit and you're automatically centrated, but you can only be automatically centrated upon contact, upon deceleration, when you have the mobility to do it. You can only have reflexive stability when you have significant mobility. The more mobility that you have, the more options you have to stabilize. I think there's a lot of big money in that, and that's where treating the entire lumbar spine, whether it's with needles, whether it's with hands, whether it's with cupping. I'm not sure cupping would get to the levels that we're talking about here, but all of these they're just treatments. And you can be attempting to go after these things for a lot of the same reasons. So I hope that makes sense. Core pendulum theory, you can go back into T equals R1. You can find that on the T equals R plus streaming platform. Just look up core pendulum. There's probably some stuff in the free sections on charlieweingroff.com. Lots of different places here. But it was just a little bit another form of stream of consciousness in terms of getting exposure, and then just seeing a slide from Leon Scheitau, who is someone else that I think would be brilliant, particularly for therapists. I don't think it has value to really dig into his presentation styles for performance, and unfortunately Dr. Scheitau has passed away, so anything that you're going to get is already out there. So it's and there's some really good things, maybe for the performance side. If you do work with a therapist, some of the stretches that would be following up the manual therapy, I think could be of use. Core pendulum theory, hopefully that makes some sense. Again, need as much mobility as possible, mobility at the spine, so you can beget that sagittal stability. So hopefully that all makes sense. And if you haven't, whatever, but if anybody has seen a leprechaun, say yeah.